Now to Multnomah County and our continuing coverage on the homeless services budget crisis. If you haven't seen any of our coverage over the past week and a half, where have you been? Here's a quick refresher. This all started when County Chair Jessica Vega Peterson made a shocking announcement that the Homeless Services Department had a budget cap of more than $100 million. She blamed lower than expected revenue from Metro's Supportive Housing Services Tax, or SHS dollars. So she asked the state, Metro, and neighboring counties for tens of millions of dollars to help close that gap. But instead of forking over the money, leaders, including Governor Kotek, wondered how that could happen. A few days later, it was revealed more than $30 million of that deficit was actually money meant to be sent to reserves, like a rainy day fund. That will likely not happen now, meaning the gap is closer to $70 million. Still no small amount. But this week, another Multnomah County commissioner says she has a plan to trim that gap even further, from $70 million down to about $48 million. Shannon Singleton spent this past weekend poring over budget request documents from each department in Multnomah County. Those documents were made public Friday. She says she found 22 million SHS dollars requested by 6 departments other than homeless services. Here are the 3 largest requests for that money outside of homeless services. More than $12.6 million for the health department, $6.6 million for the county human services department, and more than $2 million for the community justice department. So joining us now live is Commissioner Shannon Singleton to talk about what she found. Commissioner Singleton, thanks for coming on the show.
Thanks for having me. It's good to see you.
All right, let's start sort of broad here. What was your reaction when the county chair announced the more than $100 million shortfall? And did you know that that announcement was coming?
I did not know that the announcement was coming in the venue that it did. I knew that the budget transmittal letters would be public on that Friday. And the deficit was surprising. I think as far as it being $104 million, it was a really large deficit. And so I immediately wanted to understand what was underneath that and be able to start unpacking what led to that deficit.
How do you think the chair has handled this so far?
I think that it's been handled without a lot of collaboration that I would like us to be able to do as a board and as a county commission, as well as with our partners. I heard from a lot of folks at Metro, at the state, at the city that they were surprised. And I think it's really important that we don't surprise our partners as we move through this work, because we all have to be able to work together.
Not a lot of collaboration. That's something we often hear coming from the chair's office. All right, let's get into what you found going through the budget documents. 22 million SHS tax dollars going somewhere other than homeless services. Were you surprised with what you found?
With some of the investments, so when I was interim director at the joint office, we did fund some programs in other departments, but the money stayed in the joint office's budget, or now the homeless services department. So I was surprised at the shift in how it was showing up, as well as some of the investments that have been made in some of the departments.
So we want to show viewers how that money is broken down in each of these other departments. According to the release from your office, in the health department, millions going to shelter and housing, behavioral health, addiction treatment. It seems like those would be reasonable ways to spend SHS dollars to address homelessness. So why do you think that's not the case?
I think that we have to have the conversation in the context of all the investments we're making in shelter and housing. I don't support talking about shelter and housing in the homeless services department over on one side and then talking about health department investments over on another side. We are still, a $38 million deficit is still a large deficit. And so if we're having to make decisions about cutting programs, we should be looking at those programs as a whole. And we may decide as a board to keep some of the investments in the health department, but we can't talk about some shelters on one side and other shelters in a different place. I think we have to talk about them all together so that we can make informed decisions about which investments are showing the best outcomes for the folks that are in the most need.
When it comes to human services, these look to be like a lot of administrative costs. But the Multnomah Stability Initiative caught our eye here, nearly $4 million. And that program is described as helping homeless and low-income households become self-sufficient with things like energy and rent assistance and early childhood programs. So my question is, why should SHS dollars not go towards that effort?
So again, I don't know. I think we have to make that decision of if they should go to that particular department or if it's a part of our overall investments. If we're having to cut housing services or housing or rent assistance dollars, we can't talk about each program in isolation. And if we talk about Department of Human Services separate from the Homeless Services Department, we could be making decisions that don't make the most sense for the community when we look at the whole continuum.
So if your proposal goes through here, the county is still looking at a shortfall of nearly $50 million for homeless services, like you mentioned. So how do you propose to fill that gap?
So I think we have to make some tough decisions. I would love if we're able to fill the gap with additional investment. I think we have to continue conversations with our state legislative and partners. And I think we have to really evaluate what's effective. We have goals around shelter beds. I don't want us to be tied to which type of shelter or the name of the shelter. I want us to decide. We may want to have 1,000 beds, for example, but it might be a mix of congregate and hotel and motel or safe rest villages or alternative sites. But we haven't evaluated them to say what has the best outcomes and housing placed outcomes and for whom, so that we can make some intentional decisions. We've really built the shelter system in a patchwork. So everything kind of got built up over time without us saying this is actually what we need. And these are the best investments, the best way to spend our dollars to get the outcomes that we're looking for. So I really want to evaluate, and I think you'll see in the press release as well, I call for an assessment of the shelter system where we actually get the data so that we can have an informed conversation.
So I want to end tonight with something that Governor Kotek told me today regarding the SHS tax. Let's listen, and I'd love to get your reaction afterwards. Here it is.
I will say, I'm focused right now on making sure we can get to the ballot in November for the realignment of the supportive housing services measure, because I think that is the first step. And then at some point in time, the region needs to come back and talk about local money to help build affordable housing.
So, Commissioner, in your opinion, should the SHS tax be reformed? And if so, how?
I think that the conversation that Metro has had around allowable uses and being able to use dollars for affordable housing, whether that's to do gap financing or to do acquisition or rehab, or frankly to do land banking, that should be an allowable use, and that's something that would need to come back under some reform. I am open to the conversations about potential tax decreases for some of our highest income levels. I think that's something that we should be discussing and make some, again, thoughtful decisions based on the data. And I do think there's some room that we can improve right now in how we govern and oversee this money and how we work as a region, both between the counties, but also with our partners at Metro. So there's things I think we can make progress on before going to the ballot, and some of those pieces around allowable use and or any decrease in the tax have to go to the ballot as well.
All right, Commissioner Shannon Singleton, thanks so much for joining us tonight.
Thank you.